and pony show. I don't know if you've ever seen him do this.
Take it away.
Fabulous. All right. So I'm going to share my screen with everyone. There we go. Weird, it's not on the first slide. Okay, let me go into presenter mode. Can everyone see my screen?
We're looking good.
All right, and you can hear me? Things are
I
looking
hear you
up.
fine.
Hi, everyone. My name is Dr. Debbie Smrz. Thank you so much for having me. Really looking forward to presenting. So this is a topic that's very dear to me, and I'm quite passionate. So I will talk fairly quickly because there's a lot of information that I'm trying to get through in just 1 hour. If I'm going too fast and I'm speaking too quickly, just, somebody just say slow down and I will. And if you have a question, you can just, shout it out. Hopefully I've sort of moved you all to the side so I can only see a couple of people's faces, but by all means, let me know. All right, so I think you guys probably saw this. This is the plan. What we're going to talk about today is all about brain health. So we are currently in a brain health crisis. When we look at some of the numbers, over 40% of adults are reporting anxiety and depression, 20% brain exhaustion, 20% insomnia. And if we look at the statistics, mental health related leaves of absence increased by 33% from 2022 to 2023. So that's risen by almost 300% since 2017. And when we think about brain health, talking about specifically cognitive decline, dementia, which is what we're going to be focusing on today, let's look at these numbers. About 12.7 million people in the US are going to have dementia by 2050. That's a huge statistics. This is going to raise by almost 200% in 30 years. And when we think about Alzheimer's, it really is that loss of life. My mother passed away in 2020, and a friend of mine's mother was diagnosed with Alzheimer's at the same time. And she said to me, Debbie, you're actually really lucky because you can mourn your mother, whereas my mother's still here in body, but she's not the person that I used to have. So you can imagine the emotional toll that Alzheimer's dementia takes on the caregivers. And let's also think about the economic impact. So in the United States alone, $345 billion is being spent on dementia, and this is expected to rise to $1 trillion by 2050. Globally, $2 trillion just by 2030. So we're truly in a brain health crisis. And the good news is that the research is out there. The research is out there when we start looking at functional medicine, what we can do to fix the problem. But changing a belief is 10 times harder than creating a new one. So right now the ship has sailed. We're moving at full pace ahead. And to turn that boat around, well, it's tricky. And why? How did we get here? Well, there's a lot of myths that we as medical doctors are still perpetuating. We're telling people that the reason that women have more dementia than men is because they live longer. We know that's not true. We know that women's brains are so different than men. We're still talking about serotonin deficiency as the leading cause of depression. Just yesterday, I listened to a medical doctor on a podcast saying that this is still our main theory. Yet we now know this was debunked in 2020. We're telling people that dementia is an old person disease. And so, really, why worry about it until you're 65, 70 years old? Yet we know that 30 years before symptoms start is when signs of the brain are changing. So for many people, that's at 35. When this study came out in 2022, a big umbrella systemic review on all the research on serotonin. And when we read what it says, this review suggests that the huge research effort based on the serotonin hypothesis has not produced convincing evidence of a biochemical basis of depression. So we suggest it is time to acknowledge that the serotonin theory of depression is not empirically substantiated. Yet we're still touting this as some of the biggest issues out there. And in 2019, another systematic review, so showing the harm that SSRIs are doing. All authors in the study concluded that the drugs were not beneficial long term. And we know that antidepressants have been linked to increased risk of dementia. So why am I showing you these? Not because we're focusing on depression or anxiety today, but I just want to tell you a little bit about my backstory and how I got so invested in brain health in general. So just to set the scene, It goes back to, well, I guess a cold autumn day in 2016. It was a long weekend. My daughter, she was 10, 11 at the time, and she had a sleepover. And so she didn't get a lot of sleep that night. She had eaten too much sugar because there was a sleepover. And so it was a long weekend. And on the Tuesday, she stayed home from school because she had a sore throat. No problem. On the Wednesday, I said, sweetheart, I think you're okay. I think you can go to school today. She ran downstairs, grabbed the biggest knife she could find from our chop blocks, held it to her throat, and said, Mommy, if you make me go to school, I'm going to kill myself. Now, prior to this, she was a normal kid, going to school every day. And yet now this led us down a deep, dark road. She dropped out of school. So my 10-year-old dropped out of school. At least in Canada, when things get that bad, they'll send a homeschool teacher when they really don't want to see you anymore. Things got that bad. She would attack if you can find her. So she was in constant fight or flight. So she would attack if need be. The psychiatrist, psychologists, we saw everybody, you name it. They said, sure, she might kill herself, not because she's actually depressed, but because she has such bad emotional dysregulation. They diagnosed her in the 95th percentile of anxiety. Life was bad. For about 2 months, I barely worked trying to figure out what to do with this child. And it was really confusing to me because at the time, I was focusing on mental health. I was focusing on mental health in kids. So, how was it that I hadn't noticed that my daughter was in the 95th percentile of anxiety? Well, it took us about 2 months to really figure it out. And it was antibiotics that got her back to school. 5 days on antibiotics. And she looked at me and said, Mommy, I'm going to go back to school today because she had PANDAS, pediatric autoimmune neuropsychiatric disorder associated with streptococcal infection. So, quite literally, an infection caused her to have all of these neurological symptoms. Now, probably you've had somebody come and talk to you about PANDAS. Probably you've heard about it before. I'm not sure. But at the time, it was really unknown. Still to this day, many medical doctors don't admit that it's a thing. Some do, some don't. But then I started doing the research, and there were books published from the 60s talking about how infection can cause neurological issues, talking about, yeah, depression and infection can go hand in hand. Depression and inflammation go hand in hand. So now I am on a mission to change the way the world views brain health. And so let's go back to what our main topic is today, and that's cognitive decline. So we think of dementia as something that happens to old people. But we now know that it's actually a continuum of symptoms that progress. So if it's 65 is the age where we see noticeable changes, it's really down here at around 35 that abnormal biomarkers are going on in the brain, and we can see neuroplastic changes. And those mild cognitive symptoms that we're starting to see, in the menopausal woman, the perimenopausal woman, oh, we just say that's just a normal part of aging. Is it a normal part of aging? Or are these actually brain changes that we need to look at and do things to support and possibly even fix? One of the reasons that I'm so passionate about this is because 40% of dementia cases worldwide are preventable. 40% of cases worldwide are preventable. And if we can't delay, and if we can't prevent, but if we could delay, there's massive changes we could do. These numbers are from Canada. The States is 8.3 times a bigger population. So if I say 500,000 cases could be delayed, if we delayed dementia by 1 year, times that by 8.4, 8.3 to look at what you guys would be seeing. Let's go down to caregiver demand. A 10-year delay in dementia, which I truly believe we could do with what we're going to talk about today, could decrease our caregiver demand by 1 billion hours a year. That's in Canada alone. So in the States, that's 8.3 billion caregiver hours. Go to the next slide. My slides are frozen. Hold on. There we go. I'm going to talk about, I'm going to use Alzheimer's, cognitive impairment, dementia somewhat interchangeably because I don't really feel the need to pigeonhole it, but of course it's going to be in the studies. So this is just here for your information if you want to have a look at those later on. Now, to date, except for lecanemab, there's been no new Alzheimer's medication in the last 20 years. So how did we get to this place? Well, it was really from a study that was published from the Alzheimer's Society about 20, 30 years ago, where we latched onto this idea of the amyloid plaque theory of the hypothesis of Alzheimer's. And we've held on to that closely. And so almost all the drugs that we've now been using are to try to get rid of these amyloid plaques. So I mentioned lecanemab because that has been approved in the US, and it's showing a possible 27% improvement, which is pretty awesome in some ways. You know, if my parents were starting to not do well, would I put them on a drug even if it had very severe side effects, if there was a 27% improvement? I possibly might. Though when we do a little bit deeper in the research, we can see it's only about a 9.3% improvement when we actually look at it properly from baseline. And with the severe side effects, that makes us think a little bit better. So really, there are no drugs to treat Alzheimer's disease that work. So the reason being is we've really been barking up the wrong tree. We now know that Alzheimer's is not caused by amyloid plaques. Amyloid plaques are a symptom of dementia, not the cause. So this is actually great news for us because what now can we start focusing on when it comes to there's different theories of cognitive decline. And the exciting news is there's a lot of research papers that we're going to show you today that agree with us. Yes, a lot of these things, vascular hypothesis, neuroinflammation, environmental toxins, um, protein misfolding, oxidative stress, they're agreeing, yes, these probably are the causes of cognitive decline. When I look at my daughter, what were the causes of her mental health issues? Infection, inflammation, neuroinflammation, oxidative stress. So we're seeing the same baseline for many different things that are going on in the brain. Heck, let's look at the theories of aging, oxidative stress, protein folding, hormone depletion. We see a lot of similarities in both of these. So let's go into these in a bit more detail, some of them. So I want to mention the calcium hypothesis of dementia. So this one is really just saying too much calcium. So we're having an imbalance, bringing up too much calcium in the neurons, and this is leading to neural dysfunction and death. So what's happening? We're seeing oxidative stress, mitochondrial dysfunction, neuroinflammation, neural death, and this is leading to, not being caused by, but leading to aggregation of amyloid plaques and tau proteins. Now, I was reading a study that they took the elderly, mainly women, and they reduced their calcium intake. And what did they find? They actually found memory improvements. And this was just through diet, not even through supplements. So imagine if they had thrown in some magnesium. Yet, what do we tell little old ladies to do? We tell them to go take calcium because we're worrying about their bones. How much harm could we possibly be doing by having them taking the extra calcium? Something to think about. Um, Tau proteins, I want to mention quickly. So tau proteins in a healthy brain, they are stabilizing our microtubules. So we have normal tau proteins, and it's going to give us a nice healthy neuron. In the Alzheimer's brain, what we see, these tau proteins start to tangle. So then we get these neurofibrillary tangles. This stops communication through the axon. And what also happens is they start to multiply in a prion-like fashion. And so this is going to cause significant neurodecline as well. So you're going to see more and more talk about these tau proteins, and are some drugs working to try to eliminate the tau. Though again, is this actually the cause, or is it just a symptom and we need to back off a little bit? So, oh, I have that twice. All right, so what are some of the symptoms we want to watch for when we're thinking about cognitive decline? So memory lapses, that tip of the tongue phenomenon, when you know the word's right there, but you just can't spit it out, loss of train of thought, missed appointment, word finding difficulties. Then we can even get some movement issues going on, smell issues, missing appointments or social events, trouble following a conversation, a difficult time making decisions, following tasks and instructions. Now, just this week, I had a 20-year-old come and see me, and she said that she was a server and she just started taking Adderall, no Vyvanse, and she was feeling so much better because before then she was getting lost at work taking orders. She was having a really hard time following conversations. So a lot of these symptoms really do sound like things like ADHD. Some of these symptoms sound like anxiety. I know when my mom was dying, I missed appointments. I couldn't follow conversations. I was losing my train of thought quite a lot. And what about menopausal neurological symptoms? Again, that tip of the tongue phenomenon, the loss of train of thought, forgetfulness, insomnia, depression, memory issues. Are these really just these individual diseases for us to think about, or are they actually the start of possibly memory decline? We know that being female it gives you a 2 times risk. So let's talk about some of the risk factors of cognitive decline. Your brain shrinks when you're pregnant. Studies show, MRIs, your brain shrinks when you're pregnant. And for the longest time, we told moms, don't worry about it. It lasts for 2 years and then it goes back to normal. Well, that's because they only did studies for 2 years. Here's a study that looked at 6 years later, and they're like, oh, yeah, it didn't go back to normal, did it? As a matter of fact, these changes might actually be permanent. So, could it actually be that? Yeah. And they're also saying, so from moving forward, when we look at neuroimaging studies, we shouldn't just say, is it a man, is it a woman? We shouldn't just say, is it, what age were they at? But do they actually have a child or not? Because we're going to see MRI changes of the brain, we're going to see small structures. So this is actually the first strike against women, increased risk of Alzheimer's disease. We know women have 2 times more risk than men. And it's not because they live longer, as we've been told for the longest time. It's because of the changes that occur in the brain, possibly starting with pregnancy. Estrogen is brain protective, and it's your lifetime exposure that plays a role here. So how old were you when you got your first period? How many pregnancies did in progesterone? Because hot flashes are caused by the hypothalamus, but hot flashes cause micro intensities in the gray matter. And they found that the more of these micro intensities a person has is an increased risk of cognitive decline. So estrogen and progesterone really are our superpowers. Both are neuroprotective. Estrogen influences the structure. It's anabolic, so it helps with growth. It looks at neural pathways. It helps boost brain-derived neurotrophic factor. It also increases dendritic spine densities. It enhances synaptic organization and regulates the And by looking at the amount of estrogen receptor, so how dense they were in certain areas, she could predict if a woman was post or premenopausal. So here I have a picture of all these animals under a tree. My dad just came back from Namibia and he showed me a picture of all the animals trying to get that little bit of shade. So they're all hanging out under that tree. And this is exactly what's happening. The estrogen receptors are all coming to that place where they need the estrogen the most to get that little bit of estrogen, that shade. And so the more estrogen receptors, we can predict lower memory scores in general. So this is just showing just how important estrogen is when it comes to memory, mood, and cognitive symptoms. All right, age is a risk factor. That one's pretty self-explanatory. Depression. A history of depression increases your risk of dementia. Concussion. So this is a dose-dependent relationship. So 1 concussion increases your risk, 2 concussions increases it even more, and it dose-dependently goes up by that. Genetics. So a family history of dementia will increase you. This also causes enough nitric oxide to be produced by the endothelium so that insulin can go into the cell. So that's what we want to have happen. When we have insulin sensitivity, what happens is we don't get the glucose of the insulin into the cell. This causes a couple of different things to happen. One, we don't get the acetylcholine coming out. So now we don't have the messengers. So the brain can't talk to the rest of the body as well as we want. We also see an increase in tumor necrotic factor, so an increase in inflammation, and again, an increase in these amyloid plaques in the brain, decrease in their clearance, and an increase in tau phosphorylation, which is going to cause those microtangles. So that